We will be talking about the intermittent pneumatic compression machine. How to use the machine. First, you must position the patient in a supine position beforehand. Then, apply the stockinette and compression sleeve after removing clothing and jewelry from the treatment area. There are two types of compression sleeve that come with the machine. There is a compression sleeve appropriate for lower extremities and a different compression sleeve for upper extremities. Next, make sure to elevate the patient's legs. You may use a bolster or pillows. This is to increase the venous return from distal to proximal. On the machine, set the inflation to deflation ratio to 3:1. This adjusts the pressure as the treatment begins. Then, hook up the hose from the machine to the compression sleeve. At this point, you can now start the treatment. The treatment time may vary depending on what the patient needs and/or the doctor's orders. After the treatment is finished, make sure to reassess for skin irritation, remeasure the circumferential measurements, and reassess blood pressure to check if there is any other adversary reactions. This machine is used to treat and prevent deep vein thrombosis. It is used to address inactivity after a stroke, and it is used to reduce edema amongst patients with lymphedema. According to a study that was done in 2021, they investigated the use of a mobile intermittent pneumatic compression machine amongst patients with chronic venous disease. The device is called the Vecurson. Their aim was to use a mobile calf compression device that was battery operated, the Vecurson, in managing patients with chronic venous disease. This is to explore the hemodynamic effects of the IPC and to note the immediate clinical outcomes among the patients. During the study, all the patients were asked about their perception of tolerance of the device. This includes pain and discomfort. All of the information was recorded. It was found and concluded that compression therapy is an essential element in the treatment of chronic venous disorder. The device was therefore effective in reducing chronic venous disease. Another study in 2018 investigated intermittent pneumatic compression and mirror therapy in improving hand functions after stroke. The study compared two treatment protocols that improve hand functions among subacute stroke patients. The study used an experimental randomized controlled trial. There were 30 subacute stroke patients, split into Group A and Group B. Group A is the experimental group. they received both intermittent pneumatic compression and mirror therapy. For the IPC, they received it 30 minutes a day, 6 days a week for 4 weeks. And they also received mirror therapy for 2 hours a day, 6 days a week for 4 weeks. All of this in their hemiplegic upper limb. For Group B, they received manual therapy as the control group. They received arm exercises, stretching, and strengthening exercises. This was done 60 minutes a day, 6 days a week, in the span of 4 weeks. The researchers used clinical tests for sensation, motor function, and the functional independence measure as their outcome measures. Results found that sensory and motor function improved in Group A, who received both IPC and mirror therapy. It was also found that sensory impairment was improved by the IPC effect. In conclusion, hand function was improved by both IPC and mirror therapy in subacute stroke patients. These are our references. Thank you for listening.